You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Baghdasaryan. Dr. Baghdasaryan, welcome to the program.
Thank you, Randy. It's my pleasure to be your guest.
Now, before we get into today's topic, tell us a little bit about your practice. I guess your wife also is in business with you.
Yes, we met in dental school. We got married. We are married for 14 years.
Love at first sight, you said,
yes.
in dental school.
We have two gorgeous kids. We want to have the third one, working on that.
All right. Now, the two offices, I mean, do you do the same things? I mean, what kind of patients do you see?
We see many different kinds of patients. You see, we started practicing dentistry ever since 1995, right after the dental school. As a freshman, I worked in different types of dental clinics. Having a chance to see different types of practices, I came up with an idea to open a dental practice where all those different types of dental services could be provided under one roof.
Under one roof. You know, because people still don't like going to the dentist. Is that right?
Nobody does.
So do you hear that all the time? I don't like dentists?
Yeah. Some of them just say it on your face. I don't like dentists. Some of them are more polite. They say, I don't like going to a dental office. They actually say that
to your face? I don't like dentists? They say that?
Yeah. They do, and then they correct themselves. Oh, no offense, I just don't like to go to a dental office. Well, no wonder, because the history of dentistry was so painful. When somebody thinks about going to a dentist, they start wincing in pain.
Yeah.
But now everything is changed, though.
So under one roof, because
yes.
I guess sometimes you have to go to one person for one thing and another person for another thing.
Yeah, it's a tremendous service to dental patients.
So you do both?
We do everything, yeah.
That means you do the surgery.
We do the surgery.
Then you put the tooth on top. And that's normally done by two different people?
Normally it is done by two different people.
Okay, dental implants, I guess, have become pretty popular, more and more mainstream. How long have you been in and around dental implants, and what's your training when it comes to those?
I learned and started placing implants when I was doing my internship in oral and maxillofacial surgery in 1994, 1995. But my main education and training comes from Loma Linda School of Dentistry Implant Department.
Okay, so they have an implant dentistry program at Loma Linda.
Oh yes, and that's one of the best in the United States, and I can say in the world.
Okay, why do you like dental implants?
I don't just like them, I love them.
Why?
Because they are like a magic wand to give a happiness to a patient.
How so? How so?
There is no other dental restoration that could last longer than dental implants and restore a fully functional and aesthetic tooth.
So it's like getting your teeth back. I mean, that's how you describe it. For the first time in history, I guess, with dentistry, you're not just patching things up, you're actually giving them something back.
When the tooth is lost, you're giving them a tooth, which is fully functional, exactly like their natural.
You say it's the happiest group of dental patients with all the different things you do.
Because when a patient has a missing tooth, they don't have to create some more problems grinding down neighboring teeth to restore that tooth. Or if the patient is wearing a denture, they get something stable. They don't need to take it out, put it back, and it functions fully like they remember what they had before.
So dental implants, they don't fall out. I mean, they stay in your mouth. They're strong.
No, they don't. They stay in your mouth, and they are tightly bonded to your bone. The bone grows, holds on to the dental implant like an anchorage.
What are the different categories, the different types of dental implant patients that you see in your practice?
We typically categorize patients based on their age groups.
Okay.
On one side of the spectrum, we have patients that are young, who have lost one or a few of their teeth due to an accident, for example. Or these patients may even have congenitally missing teeth that need to be restored. On the other side of spectrum, we have elderly patients, edentulous patients, patients who lost all of their teeth. There is another category of patients who don't necessarily have a tooth missing, but when they go to their dentist, the dentist tells them that these teeth need to go.
Okay, so it's dentures
these patients are trying to hold on to those teeth as long as possible, exacerbating the problem, making it even worse. Now they are faced with the choice of having a denture or implant restoration.
Okay, now you say people oftentimes have been told your teeth have to go, and then they hold on to their teeth too long.
Yes.
Elaborate on that.
A lot of times because they have seen patients with dentures and they don't like that. Okay. They are trying to avoid the dentures. They usually tell me that I'd rather have my own teeth, no matter how bad they are, than having a denture that can fly out.
Okay.
What they don't know is that those teeth that need to come out, most of the time they are compromised due to dental decay or gum disease. Holding those teeth in the mouth can create some more problems.
So if they've been told by their general dentist, your teeth have to go. Okay,
Yes.
so
Then they have to go.
They're faced with dentures or dental implants. And you say 4 implants can give them something fixed in the lower and in the upper.
Yeah, with the latest technology, we can utilize only 4 or up to 6 implants.
Okay.
4 for the lower jaw, most of the time 6 for the upper jaw, to give them permanent fixed teeth that are not removable. They are removable only by their dentist.
Okay, now let's start with the 1 tooth. Going back, what's the big advantage? Why get a dental implant if you're just missing 1 tooth? What does traditional dentistry offer if you're missing 1 tooth, and what do you do?
Traditionally, we used to restore a missing tooth with bridge work attachment, which we call in dentistry fixed partial denture.
Okay.
That bridge work attachment requires grinding down healthy neighboring teeth that can create more problems. And after the bridge work attachment, since the bone underneath the bridge is no longer in use, it shrinks away.
All right.
That creates more problems for remaining teeth. With implants, we restore that missing tooth without touching neighboring teeth. And it looks, functions, and feels like a natural tooth.
So the next category of patients, they're missing, I guess, 3 and 4 teeth in the
Those
back.
people,
Why do they need dental implants?
They do need dental implants in order to prevent the further bone loss and further loss of teeth. Some patients chew with their, if they are missing teeth on both sides, they chew with their front teeth.
Now what about people, though, that they're fine, though, with, they're missing 3 or 4 teeth and they have what? What do you put in there, like a partial?
Partial denture.
Okay,
Traditionally, it used to be
so
referred to
partial.
denture.
They're fine, they have no symptoms. Why should they go in and do something about it?
Because
If they're fine.
partial denture doesn't prevent the bone loss.
Okay,
Implant
so
does.
so the loss of the bone creates the rest of the mouth to collapse.
Exactly.
Interesting.
Bone loss can make the face look sunken and
All right.
aged,
Okay.
and it creates more problems for remaining teeth.
Okay, denture wears. Let's move on to denture wears.
Okay.
You say they benefit the most. Now, the denture wearer watching this, upper and lower denture, you say 2 dental implants can give them something that
At least
snaps
2.
in, snaps out. And you brought a model. What am I looking at there?
We have a model here showing a denture here with 2 implants.
Okay.
This structure we call overdenture, implant retained overdenture.
I'm going to take a look at
With
that.
these 2 implants,
And so it just snaps right on.
yeah, it's snap in, snap out. The denture is removable.
So it's pretty accurate as far as how
Yes.
firm it is. And so can you use their own denture
Yes, you
to
can
put these
use,
little snaps?
patients can use their own dentures. Usually we make new ones for them, but they can use their own dentures. The denture is removable here for cleaning and oral hygiene, but it is securely fixed on top of these 2 implants.
Can
And
they
it
eat meat
functions-
with that? Can they eat?
Yes, they can. And this one restores the chewing efficiency up to 60%.
On the phone, you said that if there was a try-in period, that means if the denture wearer knew what they were missing, they couldn't go back to dentures. Like a weekend, try a couple of dental implants.
Even a day or 2.
Yeah.
They would never go back, for sure, 100%.
What do they say to you after the procedure is done?
They jump out of happiness, and we had a patient who walked out.
So you're looking at her out of,
Yeah, we were looking from behind the window.
The window.
My office manager called me.
and the patient was jumping up and down.
Jumping up and down, checking her teeth in the back rear view mirrors of the cars. And then, oh my God, this is so wonderful.
Because of dental implant. Okay, and it was dental implant?
Yes. We restored her 4 front teeth with dental implants.
So in the front, you could make them look real. Because I feel like I could still spot dentistry. They either look like dentures or they look like a partial of some sort.
With implants, now we have opportunity to restore the front teeth that look more authentic.
Okay.
They don't look like dentures anymore.
Have you had
Exactly like
training
the
in
natural
cosmetic
teeth.
dentistry?
Yeah,
Will you take courses?
After taking the implant courses, I've gone to different places to take courses on cosmetic dentistry.
So if somebody is in their 80s, denture wear, because 80 is not so old today these days.
Not at all.
It's not too old for dental implants.
not
I mean,
at
they'll
all.
stick in there.
No, there is no upper limit, age limit for dental implants, to receive dental implants.
Seems very
These
painful,
kind
though.
of patients, pain is a thing of the past. already.
Okay.
It's not painful at all.
They don't complain about pain.
It's not really the pain, it's the fear of pain already. Right now we are facing with the fear of pain. Patients, they don't complain of pain.
They don't.
First, they are scared. Is it going to be painful? That's one of the misconceptions in implant dentistry.
Comes up every day.
Yeah, it comes up every day.
And what do you say to them?
Well, we have patients who have needle phobia. We can use oral sedation. We can use nitro sedation. There is also IV sedation.
You do IV sedation as well?
Yes, exactly. And the patients are asleep during the procedure. They don't even remember if something was done.